Hello, everyone. Thanks for joining us for the webinar today. We're just waiting a few minutes for a few more participants and then we'll kick off. We're all ready to go, but I see quite a few people still coming in. Okay, wonderful. I think we've got quite a few participants on the line now. So, good afternoon from me in Johannesburg. For my fellow panelists today, it's I think early morning. Sarah is in New Mexico, and Mark and Stuart are in Toronto. So good evening to those of you who are to the east of us, and good morning everyone who is to the west of me, and welcome to the webinar today. So this webinar is going to give you some feedback on the work that has been done by the IAA Pandemics Task Force. And we're going to talk through a few of the papers that we've put together, and we look forward to as well having some time to engage with you on some questions. So maybe I'll just give you a few housekeeping things to get started. Sarah, do you want to go to the next one? Thank you. No, we'll go one back. So first of all, just in terms of your questions and answers, please use the Q&A tab in Zoom to post your questions. We have allowed some time for questions at the end after the three presentations, and hopefully we'll have an opportunity for quite a good discussion. So feel free to put your questions into that Q&A chat while the presentations are going on. So the chat function is disabled. You must use that Q&A. And then we will be posting the recording, and you will receive a link to that after the webinar, and so the slides and so forth will be available. So let me tell you about who is going to be speaking today. So you're going to hear from Sarah Tepema, as I mentioned. She is the chair of the Pandemics Task Force, and I'm here in my ex officio capacity, as for most of the time that the task force was working, then I was an officer of the IAA, but now I am the penultimate past president of the IAA. And then we're going to hear from Stuart Wason and from Mark Tadif, who have headed up two of the sections in terms of putting papers together for the task force. So the order of events is, oh, and maybe just a disclaimer, is that we are members of the task force, and of course the presentations today, we may well be putting our personal slant and experience on the points that we are making, and so please rather refer to the documentation and don't construe the presentations and the things that we say as necessarily being official positions. In fact, we look forward to having some debate and discussion during the Q&A. That's a really nice function of having these webinars. Your participation makes it work. So let's go on to the agenda then. You're going to hear from Sarah about the task force, and then the first paper, which you will have seen on the lessons learned. And then we're going to hand over to Stuart to talk about the protection gaps paper, which hopefully you've also had an opportunity to see. And then Mark is going to talk about the upcoming paper on modeling, and then it'll be back to me to moderate the Q&A. So Sarah, over to you.
Great. Thank you, Roseanne. It's great to be here. Thank you for joining us today. As the chair of the Pandemics Task Force, we've been working on several papers over the past many months. We kicked the task force off in the summer of 2022, and we will be sunsetting it soon as we publish the last paper. And so we're going to go through the three papers that this task force has done. I have listed here all of the members of the task force who've been a part of this and helping with all of the papers and just decide what we're doing. Just to give a sense of our work plan and of the things we've accomplished over the last couple of years. One of the first things we did was to collect everything that we could find that had been done, all research papers, reports, really just everything we could find that had been published or written about the COVID-19 pandemic, and actually even the HIV/AIDS pandemic and other pandemics. And we put them in a repository so that we could understand, just how much had been already studied about this. And that is available if somebody would like it. We're not publishing it because it would be so hard to maintain something like that and keep all of the links active. But we did, it was a fair amount of work, and we felt like it was a really actually helpful exercise to us. So anyway, that was their first exercise. And then we've done a number of other things, including updates to our liaisons to the supranational organizations. And we've done a few other presentations here and there. Another thing we did was a podcast with between Dale Hall, who's a member of our task force. Dale is the managing director of research at the Society of Actuaries, and he interviewed Matthew Edwards in the UK about the work he had done on data and modeling. What you'll find is that data and modeling is a major theme of all of this. And so not surprising, actuaries have been involved in the pandemic predominantly through data and modeling. And so we felt like it was important to give that a lot of attention. So we've got a section in our first paper on data and modeling, and then we have a whole separate other paper, which Mark will talk about. That should be coming very soon. And then also we did this podcast. And then finally, the last three items on this work plan are the three papers. So I'm going to go through that first paper, which is the lessons learned from pandemics. The goal of the paper was to do something brief and kind of give a big overview of everything that trying to summarize everything that was learned from all of the work that was done. And it was meant to be brief, and it ended up being 36 pages, which was actually quite an accomplishment to narrow it down to 36 pages. We had 16 authors, we had many, many reviewers. We have 5 pages of endnotes, so it's quite a bibliography as well. So if anyone is interested in digging in deeper to any of these topics, the bibliography or that endnote set is really helpful. So obviously you can get this paper off the IAA website if you haven't already read it. But it was naturally focused on COVID-19, but we also did talk about other pandemics, especially HIV and AIDS. There were a few members of the task force who had done quite a bit of work during the HIV/AIDS pandemic. And so it was really helpful to kind of get that additional and alternative perspective on how actuaries have worked in the realm of pandemics. And then we did everything we could to leverage everything we could find from other actuarial organizations and pulling in expertise from actuaries around the world. The objectives of the paper, again, it was meant to be brief and an overview, but we wanted to take stock of where we are as the effects of COVID-19 are waning. And they've waned even more since we began the paper. But we also wanted to provide some advice and direction for the profession in case there is a future pandemic. And I think there's consensus that there is likely to be something else in the future. So we want to make sure folks are prepared for that. We want to showcase also what the FMAs have been doing and the profession in general have been doing for data analysis, just to make sure that it's something we can share with other organizations like the OECD or the IAIS. So it's a paper that we hope can be passed around to give an idea of the kinds of things that actuaries have been involved in. We were actually specifically asked a few questions at the beginning by those supranational organizations. One of the questions that was asked was about protection gaps and how we manage those. And so there's a whole separate paper, which Stuart is going to talk about in great detail today. And then finally, we wanted to provide an overview of best practices, but also maybe even worse practices when we are collecting and working with data. And so the outline of the paper is Basically an overview of the modeling and data section, which we had a whole separate paper about, as I mentioned. Then we get into sections for each kind of practice area, and we debated quite a bit about how to organize those practice areas. But we ended up with life insurance and mortality, pensions and social security, healthcare, general insurance and or property casualty, interchangeable terms, and then enterprise risk management. And then we had some closing sections on the broader economic and social impact, and finally financial sector resilience in a pandemic. We had talked a bit about intersection with other societal and environmental issues, because it's important to note that the pandemic was a catastrophic event, especially in the world of risk and insurance. And to the extent that we can borrow from other catastrophic events or use what we learned in the pandemics for future catastrophic events, we felt it was important to talk about those comparisons. And so, for example, there's quite a bit of comparison in this paper and in the next paper with the work of the Climate Risk Task Force, who've done a tremendous amount and great work in talking about the actuarial response to climate risk. So I'll get into a little bit, I'm not going to go deep into each of these sections. That's what the paper's for. But I'm going to go just into a little bit of some of the lessons that, summarize lessons that we felt like we pulled out of this work, this paper. The first one is data. We're used to making sense of disparate data. We do that quite a bit in our daily work, but it was absolutely heightened during the pandemic. So as we all know, there were data sources from kind of all over the place. Every country was different, even down to the local cities and town jurisdictions, data was different. And some of these data were unreliable and inconsistent. And so, and they had different timeframes that they were reported and different methods that they were reported. So again, it was actually our skills, I think, can be very useful, because we're used to trying to bring together different data and make it cohesive and make it make sense. And then, the metrics could be inconsistent. So for example, at the beginning, we were getting reported cases, but sometimes we were hearing about estimated cases. And then, deaths were reported in different ways, and groupings might not match, like they might use different age bands or different geographic regions. Denominators could be inconsistent. It was kind of all over the place in terms of how data was reported. And then finally, mortality data proved very challenging. And so, we talked about this. So is it death with COVID or death from COVID? Is it, deaths that sometimes deaths weren't reported, and sometimes they were overstated, although more often they were understated. So one of the things that has definitely become a theme of all of this is that actuaries have generally started to observe and model excess deaths rather than trying to pinpoint specific COVID deaths. We've been working now with more excess deaths, and it's because it's very difficult to estimate the COVID specific mortality. So instead, we've been working with excess. And I think the definition is in the paper, but you can observe it if you'd like in the paper. The second lesson was related to collaboration and communication. We are used to working with other business professionals, and they do have to rely on us as well in order to have optimal results. And so when we respond in the future, collaboration, we know, is going to be extremely important. It's always been a challenge, I believe, to make the voice of the actuary heard in even public and policy forums. I think that differs by country. But one of the things we did notice is that there's a work of the Actuaries Response Group in the UK. They did amazing work in terms of getting on this really early and making sure they were communicating and sharing their work, and they use social media very effectively. And so they are a great example of how a group of actuaries got together and utilized social media and great communication tools in order to communicate what they were learning about the pandemic and data and deaths. And really, they were looked upon as a very reliable resource by governments and policymakers. And again, a good example. And I encourage everybody to go out to that COVID response group website just to see the work that they've done. It's well organized, it's very interesting, and they've just done great work. Other organizations, obviously other FMAs and other organizations have also done a tremendous amount of work in terms of research. And so we could maybe talk about that later, but all of the FMAs have done a ton of work in this area. So you're encouraged to also reach out to your own FMA or others. And finally, one of the things we learned in the pandemic was that there was a lot of misinformation and disinformation. And so those are sort of similar but different things. Misinformation, in my definition, misinformation is just, it's not intentionally wrong. It's just, it's not accurate information. It's not well researched. It's not, it's anecdotal, whatever it is, but it gets communicated and used. Disinformation is really the intentional use of misinformation, and disinformation can be pretty harmful, and it usually has a malicious intent behind it, or at least if not malicious, it has an intent to be inaccurate. And so we can help weed through that. We are data experts, and we can help to help other professionals to really understand what is misinformation and disinformation. Lesson 3 was related to professional practice. So during a global crisis, we need to react faster than we normally do. And that's probably faster than most of us are comfortable with. We like, as actuaries, we tend to want to be a little more cautious. We tend to want to make sure we have all of our information together, all of the data collected. But sometimes that's not possible to do quickly enough. And so we have to be able to adapt and react quickly. And the data quality, as we've talked about a lot, can be very poor and very inconsistent, and we have to make sure we're doing the best we can and use what we have, or we could be irrelevant and others could be taking over as sort of the arbiters of data expertise. And I think we all agree that most actuaries are very good at using data, applying data, and we'd like to be the ones to do that rather than rely on others who may not do it as well. One other thing that we've learned in all of this is that past experience is not necessarily reliable for our future models. And so we need to build models that are flexible and can be quickly pivoted if needed. And Mark will talk quite about this. He's got a really interesting framework set up in the paper that's coming out soon about how to set up models. And it's, hopefully will serve as a very helpful tool for actuaries in the future. Finally, one of the questions I always had was, do our professional standards as currently written, and those can vary by country, by FMA, by jurisdiction, but do our professional standards enable us to contribute to the response, or is there something in there that does not allow us to be as flexible as we need? And so I think the general consensus that we had was generally, yes, our professional standards do enable us to be flexible, but there are, I think, some cases where that might not be the case. And so actuaries probably need to consider how they can adapt professional standards to prepare for the next pandemic or the next catastrophe. The fourth big lesson that we have in the paper is that there's a lot that's needed to strengthen the healthcare infrastructure, improve healthcare data systems, and then really invest in public health interventions. That obviously changes by country and by continent and by jurisdiction again. But we noticed a lot of breakdowns in the healthcare infrastructure. Public health had various responses, but shoring all of that up will be crucial. And then finally, risk management, as a tool, not just health risk, but just general financial and business risk in the healthcare sector can really assist healthcare systems and by healthcare systems, I mean delivery systems, and where, hospitals and physicians and other providers, as well as health insurance, and really even public health systems, all of that could benefit from actuarial expertise in risk management, enterprise risk management. And that's a little bit different than talking about healthcare utilization risk, but all of those are really important factors. The next lesson is related to broad risk management. I alluded to this a second ago, but interactions between the pandemic and other risk events can lead to feedback loops and what we've called tipping points in the paper. And these need to be carefully watched and modeled. And we've saw a lot of this. There are examples, many examples in the paper that you can refer to. One of the things that sort of that tipping point leads to what we call threat multipliers. And those are really risks that interact, kind of spin that feedback loop and make other risks worse. So, pandemic and climate change, we've seen that feedback loop happening. Energy risk, we talk a bit about cyber risk in the paper. So there are other, risks that are out there that are sort of global risks that we need to be observing and ensure that we are watching how those interact with each other. And I believe that is the end of my slide. So from here, I'm going to pass it over to Stuart, who I see is back on video. And he's going to talk about the protection gaps paper. That's the second paper that we published.
Yeah, thanks very much, Sarah, and good to be with you all today. Yeah, it's my pleasure to present the key findings of this particular paper. If you go to the next slide, please. And we're five of us as authors trying to give representation around the globe to this particular important topic, which, as Sarah mentioned already, was raised by supervisors globally through the IIS and the OECD as well. Next slide. So the purpose of our paper was to give an actuarial perspective on protection gap issues arising from the pandemic as they relate to insurance. Now, COVID-19 brought us, in addition to the mortality and morbidity issues, which were a very serious consequence to our society, it also brought us massive economic losses, and one estimate of those losses was $4.5 trillion. And this brought attention to the gap between those losses and various forms of economic support, including business interruption insurance. So the focus of our paper is really on a very large protection gaps. But we acknowledge in the paper that limited forms of protection gaps can actually be quite beneficial and important in the design of sound insurance systems. Things like coinsurance and deductibles, which are used quite properly to manage moral hazard. Next slide. Thank you. So on this slide, it's just a very simple graphical representation of the relationships between total economic losses, the red circle, and various means of providing for those losses, either through insurance, the center circle, excuse me, my voice is cracking there, or also various sources of non-insured reimbursement, perhaps covered by government programs or various NGO programs as well. And of course, the diagram is not to scale. And protection gaps arise from the difference between the total economic losses and the provision from the other programs. Okay, thanks. Next slide. So in light of the massive economic losses coming from COVID-19, it was natural for stakeholders to ask if insurance could have played a larger role in reimbursing those losses. Actuaries and industry together revisited and reviewed the principles of insurability, which underlie sound insurance programs. And together they concluded that business interruption insurance for pandemic losses really was an uninsurable risk. As you take a look at on this slide at the fundamental insurability principles, the last one, for example, might stand out with respect to the pandemic as being one which indicates this type of a risk. Provision for pandemic losses through business interruption insurance is really fundamentally uninsurable. Okay, let's go to the next slide. So the authors also examined the variations in protection gaps around the globe and the reasons for those variations. Well, first of all, the size of the economic losses varied very significantly by type of business and by jurisdiction. I think many of us have witnessed that. Travel and leisure businesses suffered more than those which could be continued from home. Also, jurisdictions who were subject to lockdowns and those without domestic supply of vaccines or PPE, personal protective equipment, they suffered much more. As well, protection gap size varies with the supply and demand for specific coverage. For example, insufficient supply of coverage worsens the gap. And this could be significantly due to the presence of uninsurable risks. Also, insufficient demand for available coverage can also create a gap. And this could happen in emerging markets or developing economies. Next slide. So in the papers, the authors naturally wanted to take a look at business interruption insurance and the specific issues that arose from that coverage. Now, leading up to the pandemic, business interruption insurance was really an optional coverage attached to commercial property insurance. It was often, but not always, triggered only as a result of damage to physical property. There was also a very low business awareness of the need for and even the cost of business interruption should it be there to provide for pandemic losses. As well, contract terms were not structured really to provide for pandemic losses such as might occur due to a government declaration of a pandemic. A key feature, of course, as we now know of pandemic losses, is that there was a spread of risk across the globe, but correspondingly, for all business interruption insurance policies that were issued around the globe, they were all affected by the pandemic. And again, this breaks one of the principles of insurability. And we know as well that the size of potential losses were just, in the case of COVID-19, just massive. It estimated $4.5 trillion. That amount was much greater. It was a multiple of industry capacity at the time. And then finally, another outcome from COVID-19 that we now understand is that the impact of government actions, lockdowns, health measures, was in itself a contributing factor to the size of economic losses. Next slide. One other category of insurance that was significantly affected by the COVID-19 pandemic was travel and event cancellation insurance. While initially there were heavy losses and reserve increases at the start, as time went on in the duration of the pandemic, longer term coverages actually became profitable as travel came to a grinding halt. But a lesson going forward is it is going to be tricky to try and estimate the future protection gap emanating from these types of products due to consequent changes to contract wording post COVID-19. Next slide. So while not caused by COVID-19, there is a global life and health insurance protection gap. It has existed for a long time. It still exists. But it's not related to COVID-19 itself. Its significance varies materially by region and type of insurance. I've given a couple of stats that are available on the size of that gap. But I think one of the learnings coming out of COVID-19 was that there was recognition that mental health issues were very important. And due to the pandemic, they really came to the fore as being an issue that needed to be addressed by society, by employers, by insurers. And I think this is a work in progress underway, whereby employers and insurers alike are beginning to think about redesigning coverage to make sure that their protection for their employees is considering properly mental health concerns. Next slide. So let's turn to various stakeholder perspectives. You've already had a hint that supervisors and policymakers have been very prominent in this discussion about protection gaps already. Each of the IAIS, that's the International Association of Insurance Supervisors, a related body, the A2II, that's Access to Insurance Initiative, and the OECD have examined the nature of the COVID-19 protection gaps. Principally, their focus has been on where can supervisors play a role in the design, development, and implementation of insurance-based systems for pandemic risk. And more recently, their focus has shifted from the pandemic to taking those learnings forward into non-pandemic risks, such as natural catastrophe risks. Turning to the industry, there have been a number of industry groups that have been researching the outcomes from COVID-19 on the topic of protection gaps. The Geneva Association is one of those. They've studied the topic extensively and including talking about the importance of insurability principles. I just noted on this slide one of the comments from the Geneva Association that to them, it appears that the gap between what stakeholders expect the industry to do and what it is able to do is growing. I think that's an important message for us. Next slide. So let's turn to actuaries and our various perspectives on this topic. In addition to the work of the IAA and its various full member associations, the Actuarial Association of Europe has been active and prepared a paper on this topic of protection gaps. A couple of findings they had were that macro-prudential tools that are used by banks, in particular, they mentioned counter-cyclical capital buffers, which are used by the banks, regulators with respect to the banks, really have no role for the insurers, unfortunately, in coping with business interruption insurance. COVID-19 also proved that the impact of proved that its impact on our modern networked societies it really was not anticipated, and we need better scenario analysis. I think for myself, I think of the supply chain disruptions that occurred really around the globe, and we realized what a networked society we were, reliant on, if we call it just-in-time delivery, an unexpected outcome. But better scenario analysis may have helped us in that. Thirdly, and we mentioned this before, insurability criteria are really most important, and we need to consider them with respect to any proposed solutions that are considered. And then lastly, the pandemic impact is driven, of course, by the pandemic, but also by societal response. And both of these aspects need to be considered as we think of shared resilience solutions among all the participants in our society. Next slide. So, what's the role of actuaries? Let's just summarize that, because I think there are quite a few important messages for societies, for actuaries, pardon me. And one is the need to examine the types, nature, and extent of protection gaps, not just due to the pandemic, but also potentially other types of risks, such as natural catastrophe risks. We also need to examine the dynamic forces affecting protection gaps, and we mentioned a few of those in an earlier slide. We also need to promote and make sure there's greater awareness of insurability concepts, not only within the profession, but with our various stakeholders. We need also to examine the capacity of insurers in the insurance market to absorb losses. And we need to make sure we address and deal with issues of inclusivity and inequality of cover, because it's clear from COVID-19 that not all parts of our society were able to participate in these vaccines and healthcare solutions that might be available in some sectors, some areas of the globe. We need to also be able to align stakeholder risk management interests around the world. If we're not aligned in our approach to risk management and dealing with pandemics and related related catastrophes such as NatCat, for example, then we're not going to deal effectively with those catastrophes. And then finally, we need to help build, contribute to the building of shared resilience solutions through public-private partnerships. So that's a quick summary of the paper on protection gaps. I hope you had a chance to read it. And if not, please do so now, and look forward to your questions later on in the program. But now it's over to Mark.
Well, thank you, Stuart. I must admit that I found this paper quite interesting when I personally read it and caught up to it. So I second you in highly suggesting that members take a peek at this. It's quite instructive. So I only have one slide for our paper. As Roseanne mentioned earlier, we're in the final stages of approval within the pandemic task force, and then the paper will go through the more elaborate process of approval within the IAA, with a goal of releasing it in early 2025. So the slide is basically illustrating the table of content or the index of the paper, and I'll give you a bit of description of what's inside of each of these sections. So the first one is what do we see as a purpose for this paper? So to be consistent with the concept of what Sarah mentioned, lessons learned of the PTF, we're this time going to look at data and modeling. The paper identifies data issues that may need to be addressed to improve both quality and quantity. So this would to allow really decision-making processes to be more accurate and better decisions. It focuses the paper on model features that could provide more accurate measures of risk. As we mentioned, also, I think Sarah elaborated on this, the actuaries feel that we understand data pretty well, and we know this, I would say, almost the nuances of data and how changing one factor and breaking up a factor will improve the precision of the model. And in each section, we also like to identify areas where actuaries we feel that actuaries can help in improving both data collection and analysis and enhance model development. We also have a section on data needed and how to improve its quality. In there, we state that it's critical to establish data requirements early on to, again, improve decision-making. We recognize the availability of data and compatibility are difficult, especially in the early stages of a pandemic. While the pandemic while we were going through the pandemic, data was shifting. Data was had to be adjusted. Like I mentioned, once vaccines were available, we needed to be to recognize that now it would be important to track how many vaccinated people we had, obviously hoping and knowing that vaccines were producing good results in reducing the number of deaths. Then it became important to track separately the vaccinated people and the non-vaccinated people as best as could be. The professional bodies and health authorities across countries can identify key parameters that could improve availability and compatibility. And here we think that this is an opportunity for the IA to play a greater role by, again, raising the issue and influencing the different countries to say, look, you need this kind of data structure to be built ahead of hopefully not another pandemic, but who knows? And if it happens, your data will be much more accurate and readily available. We suggest that using excess deaths, that was also mentioned by Sarah, instead of actual reported death due to pandemic illness, may provide a much more complete view of its impact and also be less ambiguous in collecting data. This, however, obviously tracking excess deaths requires that the various administrative regions have monitoring systems of death. This is available in many countries, but other countries would have to develop this to be able to provide such a data. In our next section, we suggest that actuaries can assist in improving or enhancing existing projection models, such as help in developing new models, provide comments on assumptions considered in the existing models, review the models generated by other professionals, and also even review results and help in communication of these results. This definitely has an impact on decision making and accuracy in results. So communication is is quite important. We've seen this, at least in my country, I've seen some miscommunication, not necessarily disinformation, but really miscommunication because people using the results were not necessarily giving enough information to understand what these results meant. We also can provide independent audits of models devised by others. If we were doing this, and we hope we could, we would be tapping our expertise, for instance, in auditing Solvency II internal models, which many of us are familiar with. Abiding by our professionalism code can bring value to the other modelers. This is where we feel that Sarah mentioned, and I agree, that the professionalism guidelines that we have within all of our FMAs need to be flexible enough, let's say, for us to be able to intervene quickly. But on the other hand, we have to ensure that we respect our professionalism rules so that the value of our input is appreciated. We also have a section on sharing learning across times and across countries. Here we wanted to present how actual associations around the globe work together and interacted with the government agencies in developing and validating models that were devised at the time to project the HIV infection and the AIDS epidemic. This was quite a good result that we obtained by interacting with regulators and governmental agencies. We think that this is good to illustrate and show our skills and how we brought some different values. We draw a parallel to COVID-19 within that section by discussing some of the work done by the IOA's COVID-19 Actuaries Response Group in comparing statistics gathered among European insurers or European countries. In our final section, we deal with scenario building, again, to show actual experience in building scenarios that illustrates variability in potential outcomes. We discuss in there our typical methodologies, obviously, and we talk about model outcomes, sensitivity, and key assumptions that are characteristic of most actual models. And we present this so that readers can understand where we're coming from. So that's really a quick review of what our paper will be addressing. And I'd like then at this point to go back to Roseanne for Q&A.
Yeah, thanks so much, Mark, and everyone for your presentations. Covered a lot of ground, and we've got some great questions coming in actually. So so let me jump into the questions. So the first one actually relates to a point that you mentioned, Stuart, which is around mental health. But I thought maybe this is a point that both you and Sarah could comment on. So the question is, what did the task force see regarding mental health impacts and interactions between managing physical health / mortality risks and mental health? So, you know, those kind of interactions. Stuart, you touched on this. Do you want to add to that?
Yes. I think one of the common observations around the globe is that as a result of the lockdowns, that just the seriousness of the pandemic, when our society moved away at that time from normal daily interactions, going out to get a coffee in the morning and meeting with coworkers face to face, chatting with friends, family, etc. Move away from that, not just for a day or a week, but maybe for months at a time. This had serious consequences on a number of folks around the globe. Feelings not just of loneliness, but maybe even of depression. And as a result, productivity if they were working from home, for example, would be affected. There were reports even from some countries about possible impacts on rates of suicide. We have examples of that in the paper from one jurisdiction anyway. And so this has really led to greater societal awareness of the importance of supports and medical treatments where possible for for mental illness, mental health situations. So it actually may be not just, it may have been triggered by the pandemic, but I think it's a very good step going forward. There's much greater societal awareness of the need to properly provide for and assist members of our society who are dealing with these conditions. Sarah, did you want to comment further?
Sure. No, I would echo what you're saying. It's great that there's a lot of awareness, especially among younger people, and where, I think, well, not just young people, but everybody. But I'm seeing it especially with younger people. The stigma has been lifted a bit, which is great, and it enables treatment to come in where it might not have before. I would add to that, another sort of aspect of that is that there, at least, well, I know in multiple countries, but especially in the US, substance use disorder really ticked up during the pandemic and has, I think, moderated a bit, but is still a pretty significant issue, and overdose deaths increased. So part of that excess death number would be a pretty big spike in the US, at least, for substance use disorder, overdose deaths from substance use disorders. And then I think to address the question about the link between mental health and physical health, I know I'm aware of a number of studies that have occurred. I don't know that there are enough, though. And one of the issues, at least again back here in the US, is we have an issue with data where mental health data can be somewhat harder to integrate with medical data for various reasons. So it's a little hard to use the data to try to draw the link between mental health and physical health. But I think we all believe, at least I believe, that there is a link. I've seen it in my personal life with family members. I've seen it in a lot of the data that I've looked at, but that just, I would love to see more studies, more detailed studies that really get to that link. And I think some of those have to happen over a long period of time, because a mental health disorder can affect physical health, years later. So more to come, I think, on that. I hope that we see more studies in that area. I'd love to see, maybe the IAA participating in those.
Yeah, thanks, Sarah. And certainly in my jurisdiction, we've also seen a greater emphasis on mental health benefits in health insurance plans, which supports this notion that it's almost an investment in having those mental health benefits there to because of the link to managing other risks. So another great comment and question coming through here from Max Rudolph. So it says, thanks for the effort put into this project. It has to be challenging to work across countries for such a topic. Absolutely. The term systemic risk, as in non-diversifiable risk, was not used during the presentations. So they're asking, is that a conscious choice? It seems like it would save a lot of time in the paper and show value to non-actuaries, especially on the economic side of the discussion. So do you want to comment on this point about the pandemic risk being a type of systemic risk? Can I bat that one over to you, Sarah?
Yeah, and Max, thank you for your contribution to the lessons learned paper. So it is definitely covered in the paper, and thanks in great part to you. We just didn't touch upon it here because of in the interest of time, but obviously there is a massive systemic risk feature or aspect to all of this. And I think, we could probably spend a whole paper on that. We chose not to do that with this task force. I think there is an opportunity, though, to study further And I think the climate, and Stuart, you can comment on this, but the Climate Risk Task Force has touched upon systemic risks in a probably more broad way. I draw a lot of similarities between the Pandemics Task Force and the Climate Risk Task Force, just because the CRTF has done a ton of work and a lot of really great papers. And a lot of there are a lot of parallels that Stuart has pointed out in the lessons learned paper and elsewhere. So anyway, what I would say is, I think there's some more work we could do around systemic risks for large catastrophic events like the pandemic or climate risk or natural catastrophes or whatever it is. And I don't know, Stuart, if you want to comment further.
Yeah, and no, you're absolutely right, Max, about it being systemic. I think a challenge for actuaries in the profession is to move beyond just commenting on it being a systemic risk, but to give practical demonstrations of how it becomes systemic. And I think we tried to talk about in the protection gaps paper just some of the linkages around the globe, but such as supply chains, for example, when people are locked down and they're not in the factories, etc., then the goods that you expect to arrive for that new part, that refrigerator, or those goods coming from another country that you're reliant on for the next stage in your own production capacity, etc., or for consuming, gee, they're just not coming, and all of a sudden everything slows down unexpectedly. Things that you thought you could just get at the store or online are somehow not arriving when they should. And so I think that was a very potent lesson, I think, for us all about the connectivity we have around the globe, but I'm sure there are many others that we need to think about.
Yeah, absolutely. I think there were a lot of those kind of learnings of the connectedness that we didn't realize it exists, that was exposed when the whole world went into lockdown. So another comment here is, how do we make sure that a long delay to the next pandemic won't cause all this work to be lost? I guess this is a key reason why we embarked on this. So noting that there were similar papers written in the 1920s that seem to have been completely ignored this time around. I mean, I can certainly comment from our perspective here in South Africa that we had gone through this modeling, and actually also the politicization of modeling with the HIV pandemic. That was something that featured in the lessons learned paper. But maybe I ask all of you to comment on that one. Is how do we make sure that that this work is not lost and actually does what we intend of helping us to be better prepared in the event of another pandemic? Sarah?
Well, I'll jump in and just say one of the things we've mentioned a few times, I think in every paper, is we know that the next pandemic won't be just like this one. And so how can we quickly adapt? What are the techniques we can use to look at data? What are the systemic risks that could appear? It won't necessarily look exactly the same. So we need to be able to understand how to be flexible in our modeling and in our projections. But I hope that the content of this task force at least elevates the issue a bit, and that there's a spot on the website where someone could go and read these papers, and also go to the massive list of resources that we have at the end of the paper to dig in a little bit more deeply by FMA, by country, and that sort of thing. But so I will just chime in with those two comments and ask Mark and Stuart if they have any others.
Mark, your thoughts?
Yeah, well, it's a good point. I think what we're trying to do here is we called it, the PTF was called the lessons learned. So hopefully these lessons will not be lost after being learned. But there's an IAA role that could be to influence. In the section that I focused on with my group was data and modeling. Well, we realize through discussions among different jurisdictions that data issues are similar yet different. But one thing is that there's never enough data. And there's a lot of data out there that is not collected, not assembled quickly, not available quickly. I saw here in Canada discussions of by non-actuaries in papers that were saying in newspaper, I should to be precise, that were saying, geez, we need this. How come we can't readily get this? It's not, we could improve our models by having more accurate data and it's all over the place. We know it exists, but we can't just put our hands on it. So this, for instance, has been experienced in this pandemic, and data will be necessary in the next one or the next catastrophe that happens. And so we don't need to wait. We have an opportunity to, our jurisdictions have the opportunity to be proactive rather than reactive. And with a very good example, even in 3 years from now, the pandemic will still be top of mind, and we'll be able to recollect issues around data and make sure. In Canada, we went at the Canadian Institute, we went to Statistics Canada, which collects data across on everything across the country, but the data is produced in our different provinces. And they said, we have a great pipeline to collect data, but we're not the data generator. And so I think that's one good example. In modeling, I think that my view is that there's great models built by non-actuaries, but we have some knowledge of how to differentiate models, how use more accurate and more differentiated, I think is a better word for of assumptions, and this will improve models. So we have an opportunity as a professional body to go out and not say, hey, we can build a better model and get out of the way. That's not the purpose. I think the best way to tackle this is take an existing model, maybe one, hopefully one that was used by our administrative offices in our respective jurisdictions, and say, well, here, this model could be greatly improved by introducing more differentiated assumptions. And again, depending on the data, so we put the pressure back on the data collectors. So so that's, to me, practical examples of what we ought to be doing, I would say, in the near future.
Thanks, Mark. Stuart, anything to add?
Yes, I think Mark was giving in one of his remarks there a hint at a way forward, and we talked a bit about it in the Protection Gaps paper, is that there are other types of catastrophes which various stakeholders are now saying, hey, the pandemic was one example of catastrophic situation, but how about natural catastrophe risks, fires, floods, which unfortunately a number of us around the globe are now experiencing more frequently and with more severity. And there really is a need for the profession to be involved actively with various stakeholders in building those shared resilience solutions that a number of parties have talked about. And I think this gives the profession, if you like, a chance to shine in working with those shared stakeholders, and build those relationships, which may be helpful going forward whenever the next pandemic might come along. So I think that's something we should embrace as a profession, step forward with some of those current activities, and that will help us going forwards.
Yeah, absolutely. And I think also, I mean, from an education perspective, I mean, one of the purposes of us putting together these papers is that it also provides a resource educationally. So hopefully future generations of actuaries will have access to this information. Mark, did you want to add another point?
Yeah, just a quick one. We can do this at the IAA level, and we can also do it within our own FMAs. As you can go back, I'll go back and talk to my FMAs and say, look, let's take this live example and take the opportunity to show what we can bring to the table and do it ourselves and then share our experience. If we're successful, we can share with the other FMAs through the IA.
Yeah, absolutely. Some great questions coming through. Please keep them coming. Another question I think directed at you, Mark, but the others can also add, is around the data and whether the data that has been used in these studies is publicly available or available via the IAA or local actuarial organizations for actuaries to use for their work. So maybe some comments about the availability of data and I guess what we've learned as well about that data being more broadly available. Mark?
Okay, well, thanks, Roseanne. That's a great question. I know that within our own FMA, my own FMA, we do have databases and so on. I know that during the pandemic, we created some very specific, a bit like the IOA's responsive response group, sorry. We created some structure where we could deposit and a repository of all information that we had, and that was available during the pandemic. I must admit that I haven't gone back to see whether it is still available. I know we did a bit of structural changes within our website, so maybe maybe it got lost, but it is. And on the other hand, in the IAA, I used to be involved with the mortality virtual forum, and these guys are about to release, I think it's in, again, very last stages of approval. They're about to release a paper on excess death as a better source of tracking in such a thing like a pandemic. And they did a lot of excellent research there on the what excess this is all about, how to improve on it. And so I highly recommend that people stay aware here. And when this paper gets released, again, I think it's going to be early 2025. Put your hands on it and read through it. But again, I think that each of us could influence go back to your own jurisdiction and say, what is missing? What is wrong? Is it availability? Is this accessibility? I thought in Canada, I thought we should be pretty good at data. And then when I started reading, as I said, just in the newspaper, that other scientists were raising flags and saying this doesn't make any sense. And even our prime minister within Quebec said, claimed something. He said, all our data is collected through, I discovered out of the blue that all our data is shared through faxes. He said, how the heck can we work in this current world with faxes? He said, I got two sons that are 18 and 20 years old. They don't even know what a fax looks like, what it is. So how come we're still collecting data with faxes? No wonder we can't make decisions with good facts. We're still depending on this antiquated
Absolutely. We
tool.
all learned about the importance of the surveillance data, and hopefully that won't be lost. So, Sarah, do you want to comment on that, particularly, the work that was done across both developing and developed countries sort of flagged this point about the availability of data and the need for it to be consistent?
Yeah, well, I guess that it was not consistent, and we know that now. And I think that is just something that we're going to have to deal with in going forward if we do this again. And depending on whether it's coming from a fax or from a reliable data source, We know like in certain countries, especially, well, in certain countries there was, either no reporting or very much underreporting of deaths. So it's gonna take modeling to make sure we can apply what we know from the more robust data sources to try to make assumptions about some of the less robust countries and data sources. It will be a challenge no matter what we do, and it was a challenge during the pandemic. And I'll just say too, that again, each jurisdiction is to Mark's point, is doing quite a bit of work, and a lot of the FMAs are doing quite a bit of work in this area. So now, granted, it tends to be in the countries with FMAs tend to be a little bit more robust in their data collection and a little more consistent. However, I think there is a lot of work being done research-wise in some of those FMAs around how to interpret data, making appropriate adjustments, and trying to, not just for their own countries, but other countries as well, trying to make that data usable.
Yeah, it's so important that, I mean, we learned that slogan during the pandemic of no one's safe until we're all safe, and that interconnectedness point taught us that. So encouraging countries and supporting countries with less means to develop that surveillance capacity is actually really important when it comes to a response that is going to serve the interests of everyone. And it's certainly a big role, I think, that the IAA can play in terms of advocating for appropriate surveillance data and statistical agencies, independent statistical agencies, to be able to collect that data. And I think that talks to our next point, and this was certainly one of the challenges we had as a task force. So the question was, thanks for the hard work and the useful summary. The presenters are from countries with similar types of actuarial bodies, the USA, South Africa, Canada, and then the UK has been mentioned as well. Was there effective collaboration with other FMAs, including developing markets? So Sarah, shall I pass this on to you as chair? I think at one time I counted, 13 or 14 countries that were participating in the in the task force, but certainly always a challenge for us to get the wider participation.
Yeah, I think we had 9 countries represented by the task force. Not all of them as developed as others. However, that is the pool of volunteers we have tend to be, again, from a little bit more developed countries. There is quite a bit of awareness, I think, in that group about some of the other developing countries. We did try to collaborate as much as we possibly could, but of course, there's always more that could have been done. But we did have a pretty good representation. I think also the work of, the research work done by all of the FMAs, again, trying to bring in the data from other countries, not just their home countries. I've seen quite a few of the organizations that have done work trying to bring in, the modeling and the data from other less developed countries. But yeah, it's always going to be a challenge, I think, in the IAA to get somebody from every possible corner of the world. So we did try to bring some broad representation.
And hopefully in terms of these engagements on the papers themselves, where there are questions that people who are perhaps in markets that don't have the kind of advanced data that they raise, it obviously adds value in this process as well. So Stuart, I wanted to also ask you about sort of the alternative risk carrying mechanisms. I think, this is something you've come across in your work as your climate risk, but I mean, it's the kind of these broader systemic risks have caused their profession to have to be thinking about other risk carrying mechanisms other than the traditional insurance mechanisms. So do you want to comment on that in this context?
Sure. Yeah, unfortunately, as you say, I don't think we had too many alternatives come forward when we were talking just about the pandemic. But as you move on to the topic of climate risk, it seems like there are many more possibilities available, and I think that's because the various stakeholders in climate risk, and that includes all of us in society, each have a role to play. in dealing with climate risk. So what I mean by that is, for sure, insurance, always a kingpin, and we would hope that continues to be going forward for unexpected losses, that we can, if there are affordable premiums that for effective coverage, yes, by all means, but there are many more aspects to managing climate risk than that, whether it's reducing emissions of carbon, whether it's in the maintenance of our own properties, that we use building materials wisely, that we care for the land, the shore, the sea, rivers, in an appropriate manner that controls risk, and perhaps in a small way contributes to improved climate or more stable climate outcomes, and avoids catastrophic losses. The same message, not just for individuals, but for businesses as well. So you can see going forward with, I hope we can all see going forward from climate risk, that solutions are going to come as we act together. And there's really a need for us to act together in complementary ways and not conflicting with each other, which will lead to perhaps worse outcomes as opposed to better.
Thanks,
Yeah.
Stuart. Well said. Sarah, do
Yeah.
you want to make a comment on the professionalism aspect as well?
Well, no, I think we could, sort of lift what Stuart said into the pandemic world and say that, there are things that can be done at all levels to make something less catastrophic. Granted, we don't know what the next pandemic's going to look like, but there may be, vaccinations or participating in lockdowns and making sure that we're all kind of doing our part, and that's at the business level, and that's at the government level, and also at the individual level. So yeah, and I think in terms of practicing actuaries, I think we all have a responsibility to understand all of these interacting risks, and making sure that we are considering them in our work. There could be many downstream effects. We're seeing it as a health insurance actuary. I'm seeing it even today. We're seeing those sort of lingering effects of the lack of screenings that were done during COVID, and we need to incorporate those assumptions into our future projections for health insurance premiums, for example. And there's cases like that for every practice area. So as actuaries, I think we have a responsibility to understand this and to think about it and to even model it, the potential for a future pandemic. So I want to make sure that we are all thinking about that and considering it as we move ahead with our own day-to-day work.
Great. Well, thank you very much. I think we have covered all the questions that were coming up, and I just say thank you very much to Sarah as chair, and to Stuart for leading the work on the paper, and Mark for the paper that that is on its way as well. And I'm sure you're all, if you haven't read the papers, looking forward to reading them now that we have whet your appetite for those. And so thanks also to everyone who has joined the webinar today. And I think this recording will be available. So if you feel that there are others who will benefit from the contents, please feel free to share the link. So that's all from us for today. Thank you very much.